Good morning. I'm Erica Seamers, Executive Director for UCHealth Northern Colorado Foundation, and it is an absolute pleasure to have so many of our donors and supporters here with us today. Thank you for joining us. The UCHealth Northern Colorado Foundation supports Greeley Hospital, Medical Center of the Rockies, Poudre Valley Hospital, and our affiliated clinics through generous community contributions. Your contributions help to fill in gaps not covered by insurance and to accelerate advances ensuring the very best healthcare for our region. Philanthropic support like yours helps us to care comprehensively for our community, and I'll share a couple of recent examples. Gifts to support our cancer care program were recently used to purchase equipment to help establish a new gynecologic oncology program here at UCHealth in Northern Colorado. This is located at our cancer care and hematology clinic at Medical Center of the Rockies. Donor generosity also helped to equip our hospitals with some technology to care for a higher volume of intensive care patients. Virtual technology for the progressive care unit at Poudre Valley Hospital now provides an extra level of care for the unit and frees up other space for more severely ill patients. And of course, over the past year, your generosity has helped to bolster our healthcare workforce, providing emergency financial assistance, support for childcare in the era of remote learning, and also supporting some vital resilience building activities. Your generosity is the good to great for healthcare in our community. Thank you. For today's presentation, we have reserved some time for Q&A with Kevin at the end of his presentation. To ask a question or share a comment, you can click on the question mark icon in the top right corner of your screen. Then you can type your question into the Ask a Question box and click on the arrow to submit. We certainly encourage your questions, and again, we do have ample time to answer them, so please ask away. With that, it is now my pleasure to introduce Kevin Unger, President and CEO of UCHealth Northern Colorado Region.
Perfect. Well, thank you, Erica. Thank you for that nice introduction, and thank you, Foundation team, for putting this event together, and thank you, everybody, for joining today. And I am more than happy to answer questions at the end. And I think what I will do is do a quick kind of round robin around the region, give some updates as to what's happening at each of the different hospitals. And no talk would be complete without talking a little bit about COVID-19, of course, and what we're seeing currently and where we stand. And so if that's all right, I'll go ahead and launch into it. And I do have to mention that the Foundation team, it took them a good 20 minutes to get the glare off my head in here, and a lot of work was done to make sure that I wasn't shining too much back at you. But anyway, I do appreciate the team here, and we are located here at Harmony campus, and making sure we're all socially distanced and doing what we can to prevent the spread of COVID-19. I will start with the Greeley Hospital, and really the Greeley Hospital has been a tale of volume from day one. And so we opened this facility up in July of not this last year, but the previous year, and it has been full ever since. And so there was a great deal of demand in the Greeley market for this new facility, and now we have to figure out how to expand. And so we have a fourth floor that we can accommodate another 32 beds, and we are working on plans to do that as we speak, as well as we need more OR time in the Greeley market. So we are working on expanding both the top floor, the 2 ORs, and we have some new technology that's been a lot of fun. We have a new robot at the Greeley Hospital, which has expanded kind of our scope of services. Dr. Dubs is one of our general surgeons. He's been a terrific proponent of the robotic, the Da Vinci robot, and we now have one that is up and running at the Greeley Hospital, as well as we have 2 brand new neurosurgeons that just started to operate at Greeley, and we're excited to be there. The community has greeted us with open arms, and we see all sorts of opportunities to expand our services within that market. With that, I'll move to, let's see which hospital we have up next. It is Medical Center of the Rockies. And so MCR, This year has been incredibly busy for Medical Center of the Rockies, and as you're driving on I-25, you can see the helicopter coming and going, and it is really the regional hub for trauma care in this area, and MCR continues to grow and expand. This year was challenging, and so we saw an incredibly challenging year from a COVID perspective. But with all of that, MCR was once again recognized for the third time as a magnet hospital for nursing excellence. It is a recognition that we're proud of. What it does is it places our focus on making sure that we have a shared governance model with our nursing staff, and that we are communicating and following best practices throughout the facility that are gleaned nationwide and throughout the world. And so 3-time magnet hospital at MCR, and continued high volume at that location. We just completed our 5,000th robotic surgical case at MCR with the Da Vinci robot. Really proud of that. And then we recently also started probably my time. I've lost my sense of time. And so I think we started our TAVR programs, which is catheter aortic heart valve replacement, is what it stands for. And we've completed our 1,000th case of our TAVR program at MCR. This is leading the state, and this is a terrific alternative to open heart surgery. So less intrusive. We do not have to crack the chest, and it's a great alternative to open heart surgeries at Medical Center of the Rockies. And so we want to continue to expand that program and look at how we can continue to expand and promote that structural heart program throughout this market. Which brings us to Poudre Valley Hospital, I believe. And PVH has been, once again, very, very busy. This year, we just were recognized last week as a top 100 hospital at PVH, and we are extremely excited about that. It's the 15th year that PVH has been recognized with this designation. There's only 3 hospitals in the entire United States that have received this designation 15 times or more. And we are hoping to continue this streak. If you've been to Poudre Valley recently, you've noticed that we have somewhat of a tired facility. And so we have been looking at the floorings and the different transitions that take place throughout the organization. And we have about 30 different floors throughout the facility, and that's not a good thing. I often say that we have more flooring than Home Depot. Unfortunately, a lot of it is mauves and greens, and it was very in style probably during the 80s, but it's time for us to bring the facility up to today's standards. And so we are kicking off a $76.5 million master planning process and program at Poudre Valley Hospital, of which we will be renovating and redoing the front entrance. If you've been to PVH recently, you know that the entrance is on the back side, and I do think we've trained the community as to where the main entrance is. But as I travel throughout the market, I go to Holyoke and Yuma and Haxton and Ray, and every single hospital has a much grander entrance than Poudre Valley Hospital. And so we will be upgrading the entrance, the traffic flow, as you approach and get into the hospital. And then the first floor, I am extremely excited to announce that we're going to be really emphasizing and bringing back many of the cardiac services that we moved to Medical Center of the Rockies when we opened MCR up several years ago. And so it's time for us to really beef up our heart program at Poudre Valley Hospital, as well as we are going to be moving our GI suites out of the basement and get them closer to our surgical suites, as well as remodeling the birthing center and our women's care units as well. Most of the physical plant at Poudre Valley Hospital has not been touched in over 20 years, and we have some average age of plant that is well over 50 years. And so it's time for us to get in there, match the facility to the quality of care that's provided within the facilities, and we can't wait to kick this project off. We're currently in the entitlement process with the city, and we hope to get into the walls and start doing the renovation in October, with a completion date of 2023. Poudre Valley Hospital was built in 1925, and so we're looking forward to celebrating the 100-year anniversary with a fresh new facility, and with the goal of taking us into the next 100 years at PVH. So a lot of time has been focused there. And not on this slide is another program that I'm excited to announce to you all, and I do believe you'll probably be the first to hear that we will be providing inpatient hospice care at PVH as a trial for the entire UC Health system. And so we are partnering with Pathways, and we anticipate that we will have this new hospice program up and running within the next several weeks on a trial basis, with the thinking that we will spread this model to Medical Center of the Rockies, to University Hospital, and down to Memorial in Colorado Springs as well. So extremely excited about that. I know in the talks that I've given in my time here at Poudre Valley and Poudre Valley Health System and now UC Health, that is the common question that I get, is when are we going to have hospice care within the facilities? And it is coming, and extremely excited about that. If you've been to Harmony campus, and unfortunately if you've been to Harmony campus over the last couple of days, you can't make your right in off of Harmony. You have to go up and kind of circle around because of another construction project that's taking place at the Harmony campus, and that is a new linear accelerator at the Cancer Center. And so we have added a third linear accelerator, a new LINAC. It should be up and running in June, and that is the construction that's taken place. Not an easy project. So basically we have had to shield all the walls. They're 3 feet deep, and it is basically building a vault. And so Dr. Pettit and his team are unbelievable. We have people traveling from all over the panhandle of Nebraska and Wyoming to seek their care, and we needed to expand. And so that's the project that's taking place here at the Harmony campus. And once again, the new linear accelerator should be up and running in June, with the ultimate goal, someday it'd be wonderful to not have to have a cancer center. And so that's the ultimate goal. But in the meantime, we continue to expand our services to take care of the patients of this region and our secondary markets as well. Which brings us to Yampa Valley Medical Center up in Steamboat. They have been part of our system for a little over 2 years now. We're proud of the work that's done up in Steamboat, and if you travel up there, I can assure you, you're going to get exceptional care at that facility. We have now completed a renovation and an expansion of their emergency department. This new ED is light years ahead of where we were. And so if you remember at Poudre Valley, when we had the curtains in between the patients in our old emergency department, that's what they were experiencing up in Yampa. And so now they have all private rooms, which is terrific. They have a nice waiting area and more excitingly, we have been able to expand our behavioral health program to include their ED, to bring much needed behavioral health services to the Yampa Valley. And so a lot happening there. We are also opening up a new emergency department, urgent care center in Steamboat as well. Right on Main Street. It is, as you're coming into town, you'll notice it on it would be the west side of Main Street, and we will have that new urgent care center up and running within the next 3 weeks. And so a lot happening up in the Steamboat market. And so if you spend time there or vacation there, you can be assured that UC Health will be there to support you. So a lot happening up in Steamboat. on the community benefit front. And so on an annual basis, we are always looking at the benefit that we are able to tangibly return back to the communities. As a system, we provide just a little over $1 billion worth of community benefit to the state of Colorado, of which 427 million of those $1.1 billion are uncompensated care. Here in Northern Colorado, we provide $329 million worth of community benefit, of which $109 million is uncompensated care. Our community benefit really focuses on access to care, behavioral health and suicide prevention, as well as substance use disorders. And so this next slide will give a kind of a breakdown of many of the programs that we're able to provide because of you, our donors, and much of the money that is raised by the foundation goes to programs that you see on the screen. The Healthy Kids Club, our Healthy Hearts program, zero suicide prevention initiatives, and so on and so on. And most of these programs would not be available without your generous support. And so we can't thank you enough for what you do and the funds that you do provide to allow us to provide these programs to the community. Next slide, please. Which leads us to COVID. And it is impossible to have a talk this year without talking about COVID and the incredible response that our employees and staff and physicians and providers and community outreach have gone through over this past year and a half. And so this has been quite a journey. It has really brought the UCHealth community together as a team. Everybody, I never once heard, "That's not my job." We had people doing things they would have never dreamt that they would be doing during COVID-19. We were able to make it through without any furloughs or any layoffs. And it's because people were willing to pitch it and provide services where they were needed. And so the first wave of COVID certainly provided challenges around PPE, ventilators. Really, it was a supply crisis right out of the chute, as well as a lot of unknowns around this disease. The second surge, and hopefully not the third surge, really it's been around staffing and our abilities to staff the units. And so what has occurred from a nursing perspective is many of our staff and many staff throughout the United States have certainly been stretched, particularly in the critical care areas. We've seen some retirements just because it was an exhausting year. But many nurses also have chosen to be what's called a traveler, meaning you can go and work at different facilities on a shorter duration of time. And travelers have really been necessary in locations like New York City and Hawaii and areas where they weren't able to staff their beds. And so we are continually looking at ways that we can retain staff and recruit staff and stay on the forefront. We have a wonderful community to recruit into. We're very fortunate in those regards, and we're really working creatively with our local education community to make sure that Front Range and UNC and Colorado State, we're providing the support that's going to be necessary to continue to staff the beds throughout the system. But right now, staffing is the focus, as well as a little bit of an uptick in COVID patients that have tested positive in our facilities. And so right now we have 160 patients who have tested positive throughout the entire UCHealth system. 40 of those patients are here in Northern Colorado. And so what we're seeing, much younger patients that are being hospitalized. Mostly we're seeing 50-year-olds that have not been vaccinated. And so the vaccine seems to be very important to reducing hospitalizations. And we are working tirelessly to try to get the vaccine out. To date, UCHealth has vaccinated 560,000 Coloradans. We're proud to have been able to do that, 160,000 of which are here in Northern Colorado, and we have another 90,000 patients that are scheduled to receive the vaccine on a go-forward basis. This is going to be key to trying to get a handle on this disease. We, as a UCHealth system, are only really seeing the Pfizer vaccine, and it's a 2-dose regimen. We did receive some Moderna, but we have not had any of the J&J vaccine to date. We would be excited to do so just because it would be 1 dose instead of 2 doses. But right now, if you come to our facilities, most likely you are going to get the Pfizer vaccine, which is a terrific vaccine. And I think the state continues to ship it to us because we're able to store it. So we have the ultra low freezers and we're able to use that. Some challenges that we're going to start facing here is that I think the supply now is outweighing the demand. And so if you can urge your loved ones, friends, family, anybody that you come in contact with, and just let them know we have vaccine and we have clinic openings, and they can go onto our website and schedule, or go onto My Health Connection and schedule an appointment to come in and get vaccinated. We would love to continue to fill those clinics, but we're seeing a lull in uptake in people getting vaccinated in countries. They're shipping us quite a bit of their vaccine. Denver's seeing the same phenomena. Up through this week, we have been able to fill our clinics here in Northern Colorado, but the next several weeks looks like things are starting to taper off. We are going to try to figure out how we can do walk-in clinics so you don't even need an appointment. The challenge with that is that all of the vaccine comes in 10-dose regimens, and we do not want to waste a drop. And so we're trying to figure out the logistics of walk-in vaccine clinics. But we will continue to distribute the vaccine, and we will work on actually getting out to the communities. And I know we're going to be doing some clinics that are off-site just to try to get to vulnerable populations that don't have transportation to get to our existing facilities. So more to come on the vaccine front, but these are terrific vaccines. The Pfizer vaccine, 90% effective in preventing hospitalization and spreading the disease. And so that is an incredible number. What we're seeing right now is about 60% of our COVID positive tests are the variant, and the Pfizer vaccine has proven to be effective against the variant as well. And I think we're going to be in the vaccine business for a while, because I keep hearing rumblings of boosters that may come as soon as July. Now, don't quote me on that, but anyway, there will be a booster that will be coming as well. We continue to do testing, and the good news is we are not doing the brain poking test any longer. And so I know if you'd been tested for COVID-19, it was invasive, made your eyes water. I was tested a couple times and could not quit crying. Right now, our PCR test is much less invasive. It is basically just a swab around your nose, and it is much more pleasant than the previous test. We are turning those test results back around within 24 to 48 hours. Most people are getting them the same day, the test results back. And so we're seeing some spread throughout the schools, and the testing option is a great way to get your kiddos back in school if they need to have a negative test for athletics or to go back into the classroom. And so that is the update on testing. We are hoping that we do not see another push, another surge here, but just several weeks ago we were in the 20s, and so we've seen a doubling over the last several weeks, and we hope to not see another doubling of inpatients within the facilities, but only time will tell, and we'll see how this all plays out. I can't thank you all enough for the community support that you have provided to UC Health. May 6th is Nurses Week, May 9th is Hospital Week, and we're looking forward to really celebrating our unbelievable staff. As I said, I did a lot of discussions about upgrades and renovations and new programs, but it's our people that truly make the difference. You can have the most wonderful building, but if the staff aren't in tune and they're not focused on our patients, it all falls apart. And our staff are the best in the United States. I am not, I can say that with a smile on my face as I travel around. Our facilities have a different feel, and I think our staff feel like they are taking care of their friends, family, loved ones. Anybody that walks through the door becomes family. And I can't thank all of the providers enough for what they've done this year. It's been a challenging year without question, and your support has been phenomenal. And so we had restaurants feeding people that were, the restaurants were closed and they were struggling. Woodward, CSU, Otterbox, many of our local corporations and companies stepped up in a number of ways, and the letters were phenomenal, and the chalk art and everything else that occurred was just very heartwarming. Kept spirits up when it was a challenging time within the facilities. And so thank you for all you've done. Let's continue to mask up, wash our hands. I know we're all over this and sick of it and want to be done with it, but I think we have a little ways to go, and we need to remain diligent and making sure that we're not spreading this disease. And with that, Erica is going to join me for a quick Q&A.
Thanks, Kevin, for a wide-ranging presentation. Covered a lot of topics, and as you can imagine, we have a series of questions.
Perfect.
The first category is a few questions related to COVID.
Mm-hmm.
So if you could just go into some additional depth beyond what you might have mentioned in the presentation. Can you identify what's most concerning to you and your team over the next 6 months as it relates to COVID-19?
Yes, over the next 6 months, we are continually focusing on how we expand our capacity in the critical care areas in case we do face another surge. And in order to be able to do that, we're going to have the staff healthy and safe and able to take care of the patients. So we're going to focus on capacity management as well as our staffing. And so we have we saw a fairly significant lull in our emergency department cases as well as our urgent care cases. Both those volumes seem to be coming back, and I would like to urge you all to not avoid care if you feel like you need it. And so do not defer because you're concerned about coming into the facilities. They're probably because the majority of our staff are vaccinated. As safe of a place as you can visit, do not put off your routine visits because time can create more health issues. And so we will be ready to take care of you, but over the last couple weeks, we have seen a surge in our ED volumes. People are out and about, getting banged up and visiting the EDs. But from a COVID perspective, over the next 6 months, we're going to focus on capacity and staffing.
Very good, thank you. Can you expand a bit on the financial challenges related to COVID-19 and share kind of what the overall financial health of our hospitals is?
Sounds good. Well, we did dip into our reserves throughout COVID-19. We received some CARES Act funds, but it certainly didn't make us whole throughout this pandemic. We are also not getting reimbursement for the vaccine clinics, and so that's been somewhat challenging financially, as well as during the surges, we were not doing any elective cases within the walls of the hospital. And so we were providing care, but it wasn't always the care that keeps the lights on. And so this has been a difficult, financially challenging year for UCHealth and for the facilities here in Northern Colorado. But I am proud to say that, we were able to make it through it with full staff. We didn't have to furlough, lay anybody off, and we made conscious decisions to really dip into the reserves to make sure that we didn't have to do that. Plus, the vaccine is very self-serving for us. The quicker we can get that out, the more capacity we have in our intensive care units and our med-surg units because we're not taking care of COVID patients. And so the vaccine has been an incredibly important component of our last several months, and we want to make sure that we continue to get our communities vaccinated.
Thank you. On vaccines, you shared a bit about what the current vaccine rollout is looking like and what the receptivity to the vaccine currently is. You shared that there might be one booster starting to be available in July. Do you have any further insight as to how frequently after that boosters might be required and what the future looks like?
I wish I did, but I don't. I hear rumblings and rumors, and it sounds like it probably most likely will be a annual event. The booster, I don't know, but it does sound like they are anticipating that a booster will be on the horizon. And I shouldn't have said July, because that was just a rumor I heard it. So please don't hold me to that. But it does sound like a booster is on the horizon, and that it most likely will be an annual event similar to the flu shot.
Very good. For our audience, UCHealth does maintain some very up-to-date information about vaccines, COVID-19, so we'll make sure to send that link out to you so that you can kind of keep that up-to-the-minute information at your fingertips as well. So unrelated to COVID-19, but back to the PBH project, how long will the main entrance be under construction?
Yeah, that's a great question. It'll be a 9 to 10 month project, and it will it's going to be challenging. So we don't have the luxury of just shutting the doors and closing up shop. The temporary exit will be by the MRI, which is on the northeast side of the current entrance. And so before you go down into the courtroom, that will be our temporary registration and main entrance until we get in there, renovate, and reopen up the main entrance. And so it is going to be a construction site for the next couple of years, and please bear with us and pardon our dust, but the end game will be phenomenal. And so more to come on how we stage it and what that all looks like, but the temporary exit will be by that MRI entrance.
Okay. Can you share for our audience the relationship between UCHealth and the Southern Wyoming hospitals in Laramie and Cheyenne?
I sure can. And so we have what's called management agreements with Ivinson Memorial in Laramie, Wyoming. Cheyenne Regional Medical Center is also a management agreement, an affiliate of UCHealth, as well as the hospital in Sidney, Nebraska. We're working with another Wyoming hospital, and at our next update, I'll be able to share additional information on that. But we provide services and best practices, group purchasing arrangements, staffing help, physician recruitment, you name it, we provide it to these facilities. The majority, well, all three of those facilities are on Epic. And so we share a common electronic health record as well as with Yampa. And so if you're traveling in those locations, you'll have access to your medical information, which is awesome. And then we just provide support services to those facilities. And so when you go to Ivinson in Laramie or Cheyenne Regional, you'll see that on their signage, it says they're an affiliate of UCHealth, and we appreciate this relationship, and it allows us to expand telehealth services and other services to these locations. And so I hope I answered that appropriately. I work closely with the hospital's presidents and CEOs at those locations. They are employees of UCHealth, the hospital presidents and CEOs, and so we have a tight working relationship with those facilities as well.
Very good. Moving on to another topic that I think is has been of high interest to our community, and even more so since COVID, is behavioral health.
Yes.
So one question, one comment. How do you anticipate partnering with the behavioral health initiative across Larimer County?
Yes, and so we are the contractor for services for the new Larimer County Behavioral Health Center that will be built on Taft. And so Pathways, Summit Stone and UCHealth will be the care providers for that site. And so we're looking forward to getting that up and running and playing our part there. We anticipate that our EMS services will be frequenting these facilities, and we want to be a good strategic partner with the county to provide these services. We're also looking at ways to expand behavioral health within our current footprint, and so hopefully over the next several months we'll also have some thoughts and ideas on what we can be looking forward to at Mountain Crest, and what services we can add to this community as well. But this is a high strategic priority for us as a system. It's a state and national crisis, and we need to continue to bolster our behavioral health services, not only here in Northern Colorado, but in the state of Colorado as a whole, and UCHealth is looking at innovative ways that we can continue to provide those services.
We had a comment about perhaps a way that UCHealth can partner with others in the community on that, related to there's a tremendous need for behavioral health services, but not necessarily enough providers.
Yes.
And one of our audience members suggested that we might create more of a community coalition around offering scholarships and to help incentivize people to choose behavioral health as a career field. So we can certainly follow up on that.
And just to add on to that, many of our rural communities do not have a psychologist or a psychiatrist or access to any of those healthcare professionals. And so our telebehavioral health program really expands our reach and allows these communities to have virtual abilities to tap into these programs. But we definitely need to find ways to incentivize the best and the brightest to go into behavioral health, because it is certainly a growing need, and will continue to be a challenge if we can't get ahead of these staffing needs.
Absolutely. So lots of challenges and lots of opportunities, as is always constant in the world of healthcare. So
for sure.
That concludes the questions that I have. If there are any questions that we haven't asked, we can certainly follow up with them in the follow-up message to our audience. And thanks, Kevin, for an outstanding presentation. Thank you to our audience for your participation, for your questions, for your support. We are incredibly grateful for your partnership in advancing health in our community. Considering the economic challenges that so many in our community have faced over the last year, the foundation is focusing some of our giving efforts right now on providing assistance for patients and families who are struggling financially while also facing serious health issues. Your gift today to our patient assistance funds can help bring relief and gratitude to those who need help with some basic living expenses during this unusual time. If you would, please consider making a gift. You can visit the link that we have posted on the screen. It is UCHealth Northern Colorado Foundation.org/give-support. Again, thank you so much for joining us today. Thank you for your generosity. Many thanks to our production team from the foundation and marketing. And we wish you a great afternoon and a season of good health. Thank you.